opportunity to share with you our experience about the COVID-19 pandemic on persons with eating disorders in our country. Here is my financial disclosure. I do not have anything to disclose. And here is my agenda for my talk of today. I will first talk about what happened to persons in our countries and in other countries in relation to mental health during the COVID-19 pandemic. And then I will go into the topic of eating disorders and eating disorder psychopathology. I will discuss with you about the implications for treatment and research in this very crucial period. And then I will provide some data regarding studies that we performed on longitudinal observations of eating disorder psychopathology during COVID-19 pandemic in Italy. So first of all, the reactions to people to what happens during COVID-19 pandemic in the world and in Italy. We know that Italy was one of the first countries after China to be involved in this terrible pandemic. The first cases of coronavirus disease were reported in January from 2 tourists in Rome, and then the first epidemic outbreak was detected in the north of Italy at the end of February, and in March 11 the OMS declared the pandemic in Italy, and that was a very dramatic moment in our country because the government decided to limit the contagion, adopting severe measures of quarantine and the so-called lockdown. To understand what happened to our country, we have to take into considerations the severe measures adopted by the government. What happened was that there was a suspension of schools, factories, offices, restaurants, cinemas, and almost all the recreational activity. People not involved in indispensable activities were mandatorily confined at home, and most of the people suspended physical activity, and most of the people were forced to live within their family for their entire lives in the period across March, April, and May. People responded to these kind of measures in very different ways. But what we know from the existing literature about this topic is that people with pre-existing mental disorders were probably more vulnerable to this kind of restrictions during the COVID-19 pandemic in terms of development of specific symptoms or worsening of specific psychological and psychopathological. There are very few studies which attempted and were able to compare data about the mental health of the pre-pandemic period with the post and during pandemic period. For example, this longitudinal study performed in the UK demonstrated that the mean population mental health deteriorated with the onset of pandemic and did not begin improving until July 2020. And the mental health of most UK adults remained resilient or returned to pre-pandemic levels. Considering the specific psychopathology associated with this kind of measures and with the lockdown, literature report extreme heterogeneous reactions with an increase of substance abuse, post-traumatic stress disorder symptoms associated with the illness, with the fear of infections, with consequences to families and to peers, mood disorders, an increase of insomnia, irritability, increased suicidal risk, and domestic violence associated with trouble within family, and also worsening of pathological eating behaviors. To give you an idea of the heterogeneity of the response of people to the lockdown during the pandemic, I just want to briefly show you some very small data of this longitudinal study that we performed, because we were able to compare an evaluation performed on persons before the onset of the lockdown across December 2019 and January 2020, where we evaluated for a study on a general population, the general psychopathology of a cohort of subjects, and then we followed them at the second evaluation in April 2020, in the middle of the lockdown of the COVID-19 pandemic. And what we saw, what we observed, was that for some expectable symptoms such as depression and phobic anxiety, there was a clear increase from the pre-lockdown period to the in-lockdown period of this kind of symptoms in the general population. But, for example, for other symptoms such as interpersonal sensitivity and paranoid ideation, there was a clear reduction in the lockdown period. How we can interpret this kind of variations? Well, it is clear that for a subgroup of persons with tendency to paranoid ideation and to interpersonal sensitivity, the lockdown period provided a kind of relief of their symptoms. This is a further confirmation that the effect of lockdown, as we observed in our clinical practice, was very heterogeneous and different in regarding what was the personality trait and the mental health of persons before the lockdown period. Now I will speak about the COVID-19 and eating disorders. What happened to persons with eating disorders? Because the literature seems to tell us that this kind of population was more vulnerable to the effect of the lockdown. There are studies which demonstrated that there was a higher rates of eating disorder symptoms such as binge eating, as well as anxiety and depression in 2020 as compared to previous years. And this was for these authors, but we can agree in some way with them that some of the main reasons were lack of access to treatment, worsening of symptoms, feeling out of control, problems of emotion dysregulation, probably due to problems of lockdown and so on, need for support, and lack of physical activity. Which are the implications for treatment and research of this kind of? In our clinical practice, we have a lot of problems because there was a clear reduction of all outpatient visits. Only online psychotherapy were available, and in Italy we have a lot of problems of internet connections. Inpatient treatments were only for those severe cases of anorexia nervosa. For example, bulimia nervosa and binge eating disorders could not have day hospital or something like that. And there was no availability of family. The research provided that some of our psychotherapeutical interventions, such as cognitive behavioral therapy, enhanced cognitive behavioral therapy, has been adapted for online version, and this was very important in this crucial period because preliminary studies seem to indicate that this is comparable to the face-to-face version. But we know that studies demonstrated that there was no difference in service satisfaction before and during the COVID-19 thanks to the telemedicine and to the online visits. Even though we have to have in our mind that patients and patients' carers and staff all preferred face-to-face appointments over virtual. And what about the issue for the research in this crucial period? We know that scientific journals received a huge amount of studies regarding the interactions between lockdown measures of the COVID-19 period and mental health. And, well, maybe a lower numbers of papers regarding eating disorders, but even a very high number of papers regarding eating disorder psychopathology. And there are issues related to the huge amount of studies. Most of them were cross-sectional, and most of the longitudinal studies do not include pre-pandemic data. And there is a need for analysis of predictors of psychopathology development, which kind of environmental factors influence the development of psychopathology in patients with eating disorders or in general populations. Now I'm going to show you our data regarding the observation that we performed on patients with eating disorders in Italy across before and during the period of the COVID-19 epidemic. And this study that was performed on 34 patients with anorexia nervosa and bulimia nervosa and 97 healthy controls, we were the chance to compare the response to an enhanced cognitive behavioral therapy before the onset of the COVID-19 pandemic and after the lockdown period. The first baseline assessment at the access to our clinic was performed during January 2019. Then there was a first follow-up in November 2019. Then there was the first COVID-19 cases in Italy, then the lockdown, and then we have a third follow-up assessment of these patients. In terms of response to the lockdown and to the environmental factors, there were a lot of differences between patients and controls. But what we can observe was that, for example, bulimia nervosa patients reported increased irritability and increased fear for the safety of the loved ones as compared to controls. In terms of psychopathology, what is clear from our data was that there was a clear difference between patients and controls, especially considering bulimia nervosa patients, in terms of post-traumatic stress symptoms related with the COVID-19 pandemic and with the lockdown. But what is very interesting was that post-traumatic stress symptoms in anorexia nervosa and bulimia nervosa patients were clearly associated with the childhood traumatic questionnaire scores. In other words, we can see that patients were more vulnerable to problems related with COVID-19, which maybe were associated with cohabitations with their family and with their problematic family. So maybe persons with a history of childhood abuse were more vulnerable to this kind of forced cohabitations and these kind of problems associated with the lockdown. If we observed the longitudinal outcome of general and eating disorder specific psychopathology, we can see that there was a reduction of psychopathology from baseline to pre-lockdown period, but also reduction of psychopathology from pre-lockdown period and in lockdown period. But as you can see from these graphs, especially in bulimia nervosa patients, there was a clear interference of the lockdown period because, as you can see, the reduction of psychopathology was less clear in the third follow-up. But a serious problem was observed when considering binge eating and physical exercise used as a compensatory behavior to lack of a control over eating. What we can observe was that from baseline to pre-lockdown period, treatment was efficacious on reducing this kind of pathological behaviors. But, especially in bulimia nervosa patients, what we can observe was a worsening of this kind of symptomatology during the lockdown period. And this was true for binge eating and also for compensatory behaviors. Different explanations have been already suggested for binge eating onset or worsening during the pandemic. From one side, the food insecurity mechanism has been proposed, with pervasive media coverage about threats of food shortage during the pandemic. It is also possible that the intense use of social media might heighten awareness of body self, having a toxic influence on the objectification of the thin ideal, thus exacerbating the binge eating vicious cycle as well as the concerns about health and fitness during the confinement. It is also possible that high binge eating represented a kind of epiphenomenon of pervasive emotion dysregulation exacerbated by the preoccupations about one's own and others' safety, or about the worsening of economic condition, or, for example, problems in the family environment. This kind of model have been suggested with a reward mechanism and the center of the binge eating maintaining mechanism, associated with fewer opportunities to obtain reward from day-to-day activities, or a sufficient reward from day-to-day life activities, and less engagement in normal pleasure activities, which determine a kind of anhedonia, depressive mood, and social withdrawal. The interpretation of the results in the group of patients with anorexia nervosa appear to be more controversial. From one side, these patients showed a further improvement of eating disorder psychopathology, and as you can see, a progressive weight gain also during the lockdown. This could be explained as a kind of a consequence of the efficacy of the treatment patients continue to receive. On the other hand, it is important to note that patients with anorexia nervosa experienced an exacerbation of compensatory physical activity, and a non-negligible number of them experienced a diagnostic crossover. Overall, these results confirmed the importance of e-therapy for patients with eating disorders in a period of lockdown and difficulties to access to public services, and an importance to improve this kind of treatment for patients and to integrate also in the future with the available treatments for eating disorders. And I would like to thank Professor Valdorica and our equipe at the outpatient clinic for eating disorders.
Hello everyone, my name is Giammarco Cascino, and my presentation will focus on the impact of COVID-19 lockdown and of the following reopening period on specific and general psychiatric symptoms in people with eating disorders. The coronavirus disease pandemic has seriously affected people's mental health. Although general population has reported increased levels of stress, anxiety, depression, worries, population with a prior psychiatric condition show a higher vulnerability in terms of physical and mental health. So it was hypothesized that the pandemic would exacerbate the severity of eating disorder symptomatology due to greater level of anxiety and emotional distress promoted by social isolation and loneliness. Beyond the emotional distress, Rogers et al. Suggested two further pathways that may exacerbate eating disorder symptoms: the disruption and restriction of daily activities and the effects of media and social media. Indeed, restriction in daily life activities and personal mobility may constitute a barrier to social support, which is an important resilience factor during stressful situations and periods, also for people with eating disorders. Moreover, limitation of movement have contributed to reduced access to care, while increased media use can have exerted negative effects on eating disorder symptoms due to the greater exposure to proposed teen ideal, diet and culture related messages, and food advertising. On the other hand, people with eating disorders often report a high score on measures of perceived ineffectiveness, interpersonal distrust, and rejection sensitivity, which may promote a heightened vulnerability not only to the imposed containment measures, but also to the subsequent exposure to social life. It, it has been reported increase in eating disorder core symptoms in a sample of Australian individuals, both with eating disorder and general population. A rise in eating related concerns, a spread of eating disorder behaviors such as restricting, binge eating, and purging, and heightened psychological distress were also found in people with eating disorders. However, no study has assessed either the impact of COVID-19 on general psychopathology in people with eating disorder and the effects of the end of the COVID-19 pandemic restriction, with the following re-exposure to social life on general and eating disorder specific psychopathology. So, the aim of our study was to investigate changes in general and eating disorder specific psychopathology in Italian people receiving treatment for an eating disorder. We conducted an online survey after COVID-19 restriction had been lifted, asking participants to retrospectively rate their symptoms. Participants were asked about three time points: before COVID-19 pandemic restriction, during the imposition of COVID-19 pandemic restriction, and during the transition from lockdown to the following reopening. Patients already undergoing treatment for eating disorder in a specialist unit located in different regions of Italy were invited to take part into the study during a 20-day period from June 1st up to and including June 21st, 2020. The diagnoses were made by psychiatrists through face-to-face clinical interview, and in order to avoid self-reported diagnosis, each local investigator who was aware of the current diagnosis of patients followed at his eating disorder unit sent them an email including an hyperlink to the survey from the survey data collector of the corresponding diagnosis. The survey included, in addition to the demographic information and question regarding exposure to COVID-19 and variation in different areas of daily life, a range of quantitative questions regarding both general and eating disorder specific psychopathology. About general psychopathology, there were questions about anxiety, depression, post-traumatic stress symptoms, obsessive compulsive symptoms, and panic and insomnia. About eating related psychopathology, there were questions about body satisfaction, weight concern, binge and purging behaviors, physical activity, and frequency of laxative and diuretic use. Um, each general psychological item was rated on a 10-point scale, while eating disorder specific items were rated on a 6-point scale. 312 people with eating disorder completed the survey. Of them, 300 reported themselves as female, 11 as male, and 1 as non-binary. Uh, Most of the sample had a diagnosis of anorexia nervosa or atypical anorexia nervosa. The 20% a diagnosis of bulimia nervosa, the 15% with a diagnosis of binge eating disorders, and 7% a diagnosis of other specified feeding or eating disorders. Patients from 13 different Italian regions completed the survey. 171 from northern Italy, 49 from central Italy, and 92 from southern Italy. Regarding the clinical and demographic characteristic of the participants, as we can see, the range of age and illness duration was quite large. Half of the participants reported themselves as students, and 72% reported that they lived with family during the lockdown. The 4% of the sample reported a COVID-19 diagnosis, while regarding the treatment condition, the 65% reported that they continued the treatment during a lockdown period. And almost the whole sample was outpatients. Personal functioning changed over time, with a reduction during COVID-19 restrictions and a return to previous levels except for work or study functioning, which remain impaired after reopening, but less than during lockdown. Also, all non-specific symptoms changed over time. All of them showed higher levels during restriction and the following reopening period than before the spread of COVID-19. In particular, the levels of anxiety are even higher during the reopening than during the COVID-19 related restrictions. Regarding specific symptoms, body satisfaction, binge and purging behaviors, and physical activity changed over time, while weight concern and the frequency of use of laxative and diuretics did not. Body satisfaction was lower during lockdown than before the spread of COVID-19 and the following reopening, while binge and purging were higher during restriction than before the COVID-19 spread and the following reopening periods. Physical activity showed lower level during the reopening than during the COVID-19 related restrictions. So, overall, a significant worsening of general psychopathological symptoms was found in both COVID-19 lockdown and reopening periods. This is in line with the observed higher level of stress, anxiety, depression described in the general population as a consequence of the COVID-19 spread, and with a marked increase in general anxiety and obsessive compulsive behaviors reported in people with eating disorders. Our findings show a partial improvement of eating disorder specific psychopathology at the end of the lockdown restriction. However, the persistence of worsened general psychopathological symptoms and the further worsening of anxiety may indicate a slow recovery from the stressful period and the peculiar vulnerability of people with eating disorder to the resumption of activities inducing social exposure. Then we ran a secondary analysis in order to investigate potential risk factors associated with eating disorder specific and general psychopathology worsening reported during the COVID-19 lockdown in patients with eating disorders. To this purpose, different elements contributing to the stressful experience of the COVID-19 lockdown period, as well as factors associated with illness and treatment, were investigated and entered in the analysis. And as we can see in the picture, fear of contagion and increased perceived isolation were the variables positively associated with both eating and general psychopathology worsening observed during COVID-19 induced confinement. While a perceived good quality of therapeutic relationship was associated with a lower worsening of general and specific psychopathology. The satisfaction with the family and friends relationships were associated with a lower worsening of specific psychopathology, and the perceived social support was associated with a lower worsening of general psychopathology. While the change in economic condition, illness duration, satisfaction with sentimental relationships, and type of treatment provided, such as psychotherapy or nutritional support or psychopharmacological treatment, were not associated with any change in general and specific psychopathology during lockdown. So, with this analysis, we highlighted the potential vulnerability factors to the stress induced by COVID-19 confinement, such as social isolation, family conflict, and fear of contagion, as well as protective factors such as the therapeutic relationship, the quality of therapeutic relationship. Our study findings may encourage clinicians to keep their care to patients with eating disorder, regardless of the type of the intervention provided or the treatment delivery strategy. So, in conclusion, people with eating disorder showed a worsening of both general and specific psychopathology during the COVID-19 emergency, and the effect on general psychopathology persisted in the reopening period after the first wave of COVID-19 pandemic. These findings suggest a high stress vulnerability of individuals with eating disorders, with important effects on internalizing symptoms, which are worth of attention by clinicians. Moreover, social isolation and perceived quality of therapeutic relationship seems to be risk and protective factors, respectively, for general and eating disorder specific psychopathology worsening during the COVID-19 lockdown period.